Hi, everyone. Thank you so much for being here today. I'm really happy to be presenting with my colleagues and friends, Esther Namalwa and Asha Ulusow, about the Women-Centred HIV Care Model. And to start off, I'll introduce myself. My name is Ndung'u, and I'm a social worker. I work at Women's Health and Women's Hands Community Health Center as a program manager in the HIV and Prevention Care Cascade program. And I do have a passion for supporting women living with HIV. And I'll pass it on to Esther and Asha to introduce themselves.
Hi everyone, thank you, Mary. My name is Esther Namalwa. I work with Women College Hospital as the Community Research Leadership Coordinator, and I as well work with the AIDS Committee of Toronto as the Women Support Coordinator. I'll pass it on to Asha, my colleague, to introduce herself.
Thanks, Mary and Esther. My name is Asha, and I work at Women's College Hospital as the Community Leadership Research Coordinator. I'll pass it back to Mary.
Thank you, Asha. I'd like to start with the land acknowledgement. I do acknowledge the land and waters where I live and work, the traditional territory of the Anishinaabe, Wendat, Haudenosaunee, which is covered by Treaty 13 with Mississaugas of the Credit First Nation. Women with HIV experience vast social inequities and poor health outcomes than men with HIV. And with this in mind, social inequities such as power imbalances, stigmas, oppressions, and violence are really prevalent. And women with HIV also have unique social and health concerns requiring complex care. The unique medical care includes issues of HIV and aging, such as menopause. And there are also unique women healthcare issues like sexual and reproductive needs and other social determinants of health, like housing, food insecurity, and sense of belonging. To learn more about these unique needs experienced by women living with HIV, we did run a study from 2011 to 2018 that some of you may have taken part in, and it's called the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, or CHIWOS for short. The CHIWOS team involved women living with HIV, clinicians, researchers, community service providers, and more. And they did work together to create CHIWOS to assess and address the unique barriers and unique inequities that women living with HIV face with respect to their health care. CHIWOS is the largest community-based cohort study of women, cis and trans women living with HIV in Canada. And the CHIWOS team which includes some of the team members involved in the current study, enrolled 1,422 women from 3 Canadian provinces, BC, Ontario, and Quebec. The women who participated completed 3 surveys every 18 months with a peer research associate, who we refer as a woman living with HIV who was trained in research. And the overall aim of CHIWOS was to develop an all-encompassing women-centered HIV care model to address the unique health and social priorities of women in Canada, women living with HIV in Canada. The team imagined that this model could be implemented by healthcare providers everywhere to improve healthcare delivery and actual well-being of women living with HIV. So in 2018, this is what we came up with. The model, as you can see, is in the shape of a house to represent safety and stability, essential aspects of care of care delivery. But we also understand that not everyone may connect with that image of a house. And that's why we're here today to hear from you and adapt the model so it reflects your needs, experiences, and what safety and care looks like to you. Trauma and violence aware care is actually the foundation of the model, and this is to acknowledge the alarming high rates of violence, trauma, and intersecting oppressions that women living with HIV face. Person-centered care with attention to social determinants of health and family make up the first floor. And for many women, ensuring their family is cared for is essential to their care, and ensuring adequate housing, a livable income, and other social determinants of health. On the second floor, it contains 3 rooms: competent HIV care, which is integrated with women's health, including sexual and reproductive health and rights, and mental health and addiction care. This is important as many women living with HIV do not see any other care providers other than their HIV care provider. And on the roof, it contains peer support, leadership, and capacity building, which is integral to this model. The woman herself is the most essential component of the model and emphasizes the shared care decision-making principle of person-centered care. And the women are supported by a peer to enter the house, and together you can see the women holding up this glowing piece of peer support. Most importantly, the model is meant to be provided to all women in all their diversity. And finally, women will be of different ages at different stages of their life. So all components of the women-centered HIV care are to be delivered across the life course. After the team developed the model, the next step was to determine how the women-centered HIV care model will be delivered to healthcare professionals and women themselves, so that to ensure they use it. So the team created a toolkit for 3 target audiences: clinicians, other service providers, and women living with HIV. We knew those toolkits could be long and sometimes hard to use. So in 2024, we created something more interactive called the Pocketbook. So the Pocketbook is a small portable book meant to be used during your appointments, and it helps women speak up for themselves and have more meaningful conversations with care providers. The Pocketbook has 6 sections, just like the model that we showed earlier. It includes information from the toolkits and adds new resources also.
The first section is on person-centered care with the attention to social determinants of health and family. The women-centered HIV care model represents one of the first practical person-centered HIV care model, and it involves listening and discussing a woman's circumstances and experiences in a sensitive and empathetic way. What do we mean by person-centered care? Person-centered care has 3 components. It involves acknowledging each person is unique, is a unique individual, and the care provider needs to get to know each other, individual specifics. Having the care provider and woman working together in a shared care decision-making module to make decisions together about a person's health, and providing holistic care, meaning taking care of all the healthcare needs of a woman in one setting. In that CHIWOS study, we were telling you about women living with HIV reported that 80% of them had experienced violence as an adult, making it pretty much universal experience by women living with HIV. Trauma and violence-aware care does not mean that your care provider has to be an expert in trauma and violence, but it does mean that they know about it, know how know how universal it is, and that they take steps to be caring and not re-traumatize you. They should acknowledge the history of violence and trauma, be kind, and create a safe space. In the toolkit, trauma and violence-aware care is defined as a strengths-based approach to healthcare that understands the far-reaching forms of violence and trauma and the lasting impact that trauma and violence have on physical, mental, emotional, and health well-being. Everyone can heal from trauma and deserves a trauma and violence-aware care where providers understand what trauma is, how pervasive it is, understand how it has great impact on people's lives, create a safe and supportive environment, support healing and recovery, foster trust, and minimize traumatizing. The Pocketbook has information on what trauma and violence means, plus resources and experiences. If you're feeling overwhelmed, there is a grounding exercise you can follow with step-by-step instructions and pictures. It helps you calm your mind and feel more present. HIV care is the next section. In the toolkit, complex HIV care is defined as effective ongoing treatment for HIV, including prevention, screening, management of concurrent conditions to improve a woman's overall health, longevity, and quality of life. It is so important to know that women who are diagnosed with HIV can live a long and healthy lives, and care providers should work with you to support you to achieve this. The toolkit lays out HIV care to include initial care which includes counseling, starting HIV medication, and ongoing care. Also, the toolkit says that your care provider will take steps to understand your current and past health history. They should work with you to figure out if your medication plan, and they should take any concerns about side effects seriously. They will work with you to lower your risk of getting other infections and illnesses. Your care should improve your overall health, longevity, and quality of life. We know HIV science can feel overwhelming. The Pocketbook includes a section where you can track important things like your viral load and your CD4 count. We also have information about you equals you, which means undetectable equals to untransmittable. If you take your medications on time and keep your viral load undetectable, there is zero risk of passing on HIV to others. There is also a section about disclosure, who you legally need to tell and who you don't. There is also a vaccine tracker. You can use it to keep a record of your shots, dates, and whether you're due for anything.
Okay, so the next section is on women's healthcare, which includes sexual and reproductive health and rights. In the toolkit, this is defined as a comprehensive and holistic care to women living with HIV across the life course that addresses and prioritizes their sexual and reproductive choices and rights. Sexual reproductive health rights is the concept of human rights applied to women's sexuality and reproduction. Sometimes having conversations about sexual and reproductive health may be hard to have with healthcare providers. In the Pocketbook, we have resources and information about sex, sexuality, gender, as well as information related to menopause, breast and chest feeding, and your sexual history. We have prompts for you to use to begin having those hard but important conversations about your own sexual and reproductive health needs to your healthcare provider. So the fifth section of the toolkit is on mental health and substance use care. The model of care and the toolkit does something that's quite rare. It presents a model where HIV care is integrated with women's health and mental and emotional care. In terms of screening and management of common mental health conditions, we proposed a step care approach to mental health. So step one is that healthcare providers proactively screen women living with HIV using a validated assessment tool. Step two is to offer women who are identified as having potential mental health conditions some low-intensity treatments, such as brief counseling and treatment, tips on self-care, or referrals to support groups. And then finally, step three is if the mental health condition is more severe, it is common to refer women to higher intensity therapies if needed. So the Pocketbook, in the Pocketbook, we have prompts on how to bring up mental health when talking to your healthcare provider, as well as resources such as lists of mental health providers to be referred to. Taking care of your mental health is important, and this table has tips like taking part of in self-care activities that you enjoy, like walking in nature, getting enough sleep, reaching out for support or just hanging out, and then exercise, meditation, or others, or doing even their ceremony. The final section of the toolkit is on peer support, leadership, and capacity building. The toolkit emphasizes that you have a right to take part as an active and equal member of your healthcare. You also have the right to participate in the design, delivery, and evaluation of healthcare for all women living with HIV. Peer support refers to support for individuals who have lived experience that are similar to yours. Peer support can be delivered one-on-one or in groups, in person, on the phone, by text, email, or even through the internet. Peers can be helpful by sharing information, providing mutual connections, and a sense that you're not alone. So peer navigators are peers who help guide, connect, refer, educate, and accompany other peers throughout their journey in the healthcare system. Peer leadership refers to women living with HIV who take roles that recognize and use their knowledge and expertise about HIV. This can offer care providers, researchers, policymakers valuable information about the needs of women living with HIV. Getting involved in the HIV community this way has been shown to improve health and well-being of many women living with HIV. But remember, it is also totally okay to use services without becoming involved. You may require training or support to build your capacity to be in a leadership position or participate meaningfully in your new role. Okay. The Pocketbook contains more information on peer support and what that may look like for you. We want to gratefully acknowledge all the women living with HIV who participated in CHIWOS and in the toolkit development, as well as the Women-Centred HIV Care working groups, our community and clinical partners, our funders, the Canadian Institute of Health Research, and all of you. We also want to honor the 1,422 women whose voices will forever live and make change through this toolkit, and to remember the 73 of those women who are no longer with us, but whose voices will be forever heard. Thank you for listening.